Let's go. Let's do it. Fantastic. Fantastic. We'll be on in a minute. Fantastic. Good evening, everyone. I'm Tony Okpesomi, a family practitioner who treats HIV and substance use disorder in Maryland. Pardon my voice this evening. I partied too much, according to my daughter, over the weekend. We had the awards ceremony in New York, and it was phenomenal. So I came back with this voice. But my daughter Yowande is going to be co-hosting with me tonight, so that we can, achieve success, and so that you can hear what needs to be said and not worry about my voice. So tonight we have one of our very own, one of our very own family on Medical Mondays with Dr. O, Dr. Kehinde Elisha, founder and CEO of NP Certification Academy, who is doing amazing in prepping our nurse practitioners for their exams, and go online to see her success rate. It's fantastic. She's just phenomenal on that platform, on Medical Mondays with Dr. O platform, and all other platforms. A giver, a lover of people, one who wants the best for our community, and has decided tonight to share with us coping mechanism and stress management for not just professionals, but for everyone at large. She's also an at-large representative for Loudoun County Department of Mental Health and Substance Abuse. So without much ado, I'm going to yield the floor to Dr. Kehinde Elisha. The floor is yours, and welcome.
Well, thank you so much for that amazing introduction. I really appreciate you having me on tonight. And it was so nice to see you yesterday, and congratulations again on your recent award. So tonight we're going to be talking about coping mechanism and stress management for everybody. You just look within yourself. Tell me that you have never been stressed before. Tell me that you have the best coping mechanism. Probably, I don't think anybody here will say yes to that. So tonight we're going to be talking about some things that actually, you know, got us here to start with, or the things that are generally leading to it. And the most important thing is actually the newest innovation, which is the AI, which is great. But we also get stress from that, and why and where the source of the stress is from, and what does it mean, and what is the link between AI and stress. I'm also going to talk about that. I'm also going to be talking about, ethical and emotional and autonomy stressors from AI. I will talk about that because right now people are losing their jobs, and that's actually one of the main reasons why people are stressed. So that's why I'm going to heavily emphasize on AI a little bit today and our day-to-day life. And then most importantly, I'm also going to talk about how to cope. Like, we know stress is going to come. It's something that is way beyond our control. Whether I would like it or not, stress is going to come. But when they come, how do we cope? So I do have some coping mechanisms that I'm going to share with us tonight. I'm going to also discuss some unhealthy coping mechanism, and I will talk about the healthy ones. And then what are the types of coping mechanisms that we generally have in psych, and what does it mean? And what are the examples to help us connect with those coping mechanisms? And then you will also see me talking about ego defense mechanisms. So we have quite a few to talk about tonight. So I'm going to get started right now without further ado. But do we have any questions before we start, though? Does anybody have any concerns or anything that you really, really want me to hit hard on? Are you going through that stress right now? You are finding it difficult to cope? Even it doesn't have to be AI related. Please drop it in the chat, and I'll find a way to integrate with my current topic. Thank you. Okay, anybody? Okay, if you don't have any comments tonight, make sure you drop it in. I will be looking at that shortly. I think we have a comment right there. Okay, so that's Dr. Hope. So now, so when it comes to stress, what is our main stress right now? Truly, a lot of our stress right now is actually coming from AI. And that is from, we're thinking, okay, AI is taking our jobs, and it is taking some jobs. Let us be realistic here. So what are the sources? Number one is job insecurity, increased workload, skill or obsolescence, like skill that is out of date. Excuse me, I couldn't pronounce that word. Unrealistic expectations and constant change. So now when it comes to AI, things are very, very fast. Those things that we generally like seek help for, we don't need to seek help for them anymore because you prompt an AI and then it gives it to you. It may not always be accurate most of the time, sometimes, but for the most part, it is actually more accurate than humans, which is a threat already to humanity. And that is kind of why I'm linking it to stress. There are other sources of stressors, but it's actually somehow making it worse. If we think about the big picture of it, apart from jobs as well, we also look at other prompts, even when you look at other situations like relationships. Some AIs are replacing that. Look at counseling. Some AIs are replacing that. And then when we talk about mental health too, how is AI also creating a major issue? It's also creating issue when it comes to people believing believing AI over humans. See what I'm trying to say? Like they're believing AI over humans in the sense that some teenagers, especially if they don't know what or where to go for advice, they go to AI. Eventually, they end up with suicide. That is happening a lot now, and we're trying to create more education surrounding this. But anyway, a lot of stressors come, first of all, for adults, definitely job insecurity. A lot of people have been cut off from their job because now we don't need that many staff anymore to do certain jobs that we do. So that's AI for that. Now, when we talk about the second table here, talks about ethical, emotional, and autonomy stressors from AI, what are they? So you feel like you're no more, you know, you're no more independent. Okay, clinicians, teachers, writers. So AI systems will influence or take over some key things that we do. For example, even diagnosis. A patient can go onto AI prompt, throw their symptoms on there, and boom, it pulls it up. Now, if a physician sees that or an MP sees that, they can feel a little bit threatened. That is a stress right there that, okay, what is the future of my job going to be? And that is, how we start. And then it goes down that path. Then data privacy concerns. I can tell you right now, in the next 5 to 10 years, we think data privacy is breached right now. It's going to get worse because people are just throwing anything onto AI. Let's not forget, they are storing most of those things. Okay. That is not to say that AI is bad. Again, I'm just trying to come up here to let us kind of see how AI actually led to some of our stresses or stresses of life. Now, what about bias and ethical dilemmas? So judges, recruiters, and law enforcement, they have the fear of liability from AI-driven biased or unfair decisions. What about surveillance and monitoring? Remote workers, call center agents, they've been, replaced in a way. We do have these, they call them, I don't know, remote, or what do they call them again? These people that you can, um, you know, maybe hire for them to pick up your calls, make your call, virtual assistants. That's the word I was trying to remember. So that is all AI related programs. Okay. What about dehumanization of work? And that is now what actually is, to me, I find that really bothersome. Customer service, therapists, customer service particularly. A lot of times when you call a bank, especially when you get scammed and money just disappeared from your account, you really, really want to talk to somebody. And here you are, you just can't find somebody to talk to because now customer service is being replaced with AI, right? So those are the things that create some stress to humanity. So how do we cope with all this stress? Now, the way we can cope in two ways. And coping, um, you know, divided into healthy ways, and we also have unhealthy ways. So what are the healthy ways of coping? The healthy ways of coping includes problem focused, emotion focused, social support, cognitive reframing, relaxation techniques, physical activity, spiritual practices. So yeah, spiritual practices. So going to church, going to mosques, or whatever your religion is, it always brings some kind of comfort, some kind of relief, even though we don't see it that way, or talking to the right people, you know, as opposed to keeping things in. But anyway, these are all healthy mechanisms. So problem focused, what does that really mean? You want to tackle the issue directly. You want to reduce, that will help you reduce or eliminate the stress when you tackle with it. For example, if that stress requires setting boundaries, do it. If it's time management, do it. And then seek solution in some other ways. This is not only AI, this is generally with stress. What about emotion focused? You want to manage emotions as best as you can. Don't let things get so deep to you that you can't even function anymore. So a lot of times we do that with journaling, talking to somebody that you trust, or practicing some kind of mindfulness skills. What about social support? Seeking help, empathy, and resources from other people, like calling a friend again, and so on and so forth. Cognitive reframing. changing how you actually think. That is positive. That is healthy. Changing how you think, changing how you see life, you know, turning a negative situation into positive. There is a way we can do that, either verbally or mentally. That way, the impact is less on us. Thinking like, okay, AI is there. I know that a lot of jobs are going to be gone, but hey, that AI can also create so many things. I'm going to just go ahead and look at AI and learn it and be, flexible at changing careers or learning something new and see what I can create with it. Now you are now trying to adapt to the current situation. That way it doesn't get you down so low that you are not able to function or that you give up completely on yourself. What about physical activity? You got to move around. It's not only like a way to lose weight, it's also a nice way to actually relieve that stress and possibly, boost your mood. What about spiritual practices? Definitely I spoke about this. We all have different kind of faith. Trust me, it's going to do something to you positively. What about maladaptive or unhealthy coping mechanisms? Okay. These are avoidance. It is right there. The problem is right there, but you want to act like it's not, it doesn't exist. You want to cover it up. It's just going to eat you up practically because you're going to be in denial. You're going to go in through emotional withdrawal, making it a little bit unfair for those that are living around you or for those that are relating with you or even for those that are working with you. So it's a negative coping mechanism. What about substance use? This is worse. Using drugs, using alcohol. We don't want to turn to that. Aggression, lashing out over small things. It is, again, not fair to those around you. You're yelling, you're physically violent, you're blaming other people for things they don't even know anything about. Those are all negative coping mechanisms. What about overcompensation? That is excessive behavior to mask the stress. For example, compensation is, oh, I don't like to cook. I'm just going to go ahead and stay at work till 10 p.m. Eastern time so I don't have to cook when I get home. Those you are overcompensating. You're trying to like put all energy into something that you love to do, which is work, and then you want to mask the fact that you don't know how to cook. Now, what about self-harm? Hurting oneself to cope with emotional pain, like cutting yourself, hitting with oneself, risky things, disordered eating, just, going into some kind of binging or purging or restrictive dieting. What about social withdrawal? You isolate yourself to avoid dealing with the stress or feelings, canceling plans, avoiding conversations. Those are all negative. So now in psych, we also have some other kind of coping mechanisms. You know, we have problem focused coping, we have emotion focused coping, we have avoidant, and those are just kind of self explanatory. But I want to focus more on the ego defense mechanisms. Now, ego defense mechanisms, I find it interesting. I'll be spending some time on this. And why is that? Again, we have healthy here, we have unhealthy, because this right here actually reflects on most of us as humans. And it's just nice to become aware of it and be able to, find a way to deal with it before it really gets worse. So what are the positive ego defense mechanisms? We have sublimation, we have suppression, we have humor, we have altruism, anticipation, we have intellectualization. I know it's sounding like a big, big thing to speak. It's not. That is some things that we do. And I'm going to go ahead and break them down now with examples to kind of go with it. So the other one that I did was healthy and unhealthy one. Those are general for just for layman. Now I'm taking it a little bit into academic, okay? What we actually have on APA website and generally acknowledged in psych, we call them ego defense mechanisms. As humans, we all go through some kind of ego states. So I'm going to break each of them down with real life examples. And if you do see yourself in any of this, just take it and look more into it and find a way to redirect whatever you see as negative, redirect it to positive. But if you have any of this I'm about to talk about, you have positive ego defense mechanism. And you just tell me whatever you see yourself in, and we can make it a topic afterwards. So sublimation, suppression, humor, altruism, anticipation, intellectualization. So what is sublimation? Redirecting unacceptable impulses into what? Positive actions. For example, uh, this is very, very simple and straightforward. Like you meant to get angry with somebody and you just had to go to kickboxing and start doing kickboxing. Kickboxing, if you don't know, it's more of an exercise, some kind of workout. And weightlifting is an exercise too. So you have turned that negative thing to positive because you're angry. You don't want to be angry at somebody. You tossed it right onto kickboxing or weightlifting, right? And then what are the real life example that you can give? Example two, using a grief to start charity. For example, now, I was at a public event last weekend, not last 2 weekends ago. It was like something like for people that are on drug and opioid abuse. And they lost, sadly, some of these parents, they lost their kid to either alcohol, I mean fentanyl or something like that. And they have the table, they have the picture displayed on the table. And, you know, and they are actually raising money to give to other people or to buy, let me say, Narcan, which is a reversal drug to help other people have access to Narcan so that they don't die because of OD. So that is sublimation. They are grieving about their family member. They are looking at, hey, how do we prevent this in future? That is sublimation. Does it make sense now? So the next thing I'm going to talk about, and the significant is not really necessary. Let's just get the concept down so I don't spend too much time presenting this. Suppression, okay? If you're doing this, you are doing good. Sublimation, you are doing, so hold on to it, continue to do it, all right? Well, now what about suppression? Suppression is consciously delaying attention to distressing thoughts. Consciously, you're aware of it. You know you are suppressing it, right? You know you are suppressing it. But because you are bothered by it, you want to continue to do what you're doing to suppress it, to keep it down. So choosing to focus on work despite personal conflict. So some people that are workaholics, seriously, they may not choose to be. Maybe that's what they have to do to get through whatever is on their mind. That is suppression. And that is not the same thing as denial. They still know the problem is there, but they are able to work it off. See it that way. Even if it's going to the gym every day, they are able to work it out of their mind, right? So holding back tears during a presentation, then crying at home. You have suppressed it, but it will still come out in some other way. But it's not negative. That's a positive mechanism. Now, what about humor? Oh, I use this a lot. Using laughter to cope with stress without denying the pain, like making light jokes during cancer treatment. I do this with my weight, period. Okay. I'll say, you know what? What do I say about my weight? I say some crazy thing. Okay, when I'm teaching like trans theoretical model of change, I give weight as an example. Okay, TTM is a theory that who came up with Pocheska came up with that theory, and that theory usually give a substance abuse as an example. That if you have a substance or drug use, you should pre-contemplation stage you think you don't have a problem, contemplation stage you realize you have a problem and you want to start making a change. Now I turn that alcohol to weight. I would say, well, TTM, let's talk about it. Okay, pre-contemplation, if you have a weight on you and you're denying that you don't have weight. And the second stage, contemplation, you have weight and now you're sleeping on the job, then you realize that, oh, I think I have weight. I need to look into doing something about it. Does it make sense? So you kind of turn it around and turn it into joke, making your own life story. People that throw their life story out there, they are not trying to do it because it doesn't like affect them. Does it make sense? But they will throw it out just to kind of like take the weight off. Obama, we joke about him using drugs as a, maybe not drugs, some kind of substance. I don't want to say exactly because I don't remember, but I know he was using some kind of substance as a kid. He said it publicly, and this kid was behind him, a young black kid. I said, "Are you talking about you?" You know what I'm saying? Like a president saying that in public, just throwing out some kind of humor is just finding a way to cope. Does it make sense? So that is kind of a positive defense mechanism. What about altruism? Altruism is managing anxiety by helping other people, volunteering for after a breakup, for example, or you have some, you know, or let me say maybe you have some food in your car and you happen to be driving on some street in DC and you find these homeless people, trying to get some food and you have some food in your car that you yet to touch for the past 3 hours and be like, you know what? I'm going to be altruistic. I'm going to give a piece of me to you. Now you might be coping with something, but the fact that you just gave something out, you give a piece of yourself out, that is really nice. You're trying to cope that way. It's a positive ego defense mechanism. Dr. Opesomi right now too. I'm not saying she's coping with anything, but right now she's being altruistic. She has actually devoted the entire Monday to the public, to the society. She's been altruistic. She will provide this platform to actually give a piece of herself to us, right? To learn, to grow. And she would do that even individually with people. She is being altruistic. So that's a positive ego defense mechanism. What about anticipation? preparing mentally for possible stress, mentally preparing for a tough conversation, for example. You have an exam, you are mentally preparing that, okay, let me work it out. I'm about to go on this. I have 5K run next week. I don't know if I'm meant, I don't know if I'm, I don't know if I have any anticipation or not, but I have 5K run to run on the 27th. Golly. I haven't practiced in the past 2 weeks, so I'm not really anticipating anything good, but I'm looking at, oh, how am I going to do this? But at least it's sitting in my mind to think of, okay, how am I going to cope? What if I can't run? Can I walk? That is anticipation, right? Now, what about intellectualization? Focusing on logic to avoid emotional overwhelm, researching medical terms after a diagnosis, discussing the facts of trauma without showing emotion. I can bring myself in this too. I was in anesthesia school and I made it my first year. My second year, I didn't pass my pharmacology of anesthesia. I say it in my class every time. I'm comfortable telling my students right now because at the time when it happened over 11 years ago now, it was traumatic for me. I felt like I lost something because that was what I waited for throughout my career. And now I didn't make it because of one reason or the other. So intellectualization is I come to class and I talk about it, but it doesn't bother me in any way. If anything, I thank God for not making it, period. So that is intellectualization because now I have a different path, right? Now let's talk about unhealthy ego defense mechanism. So what I can get from here, would you agree with me that what we can get from here is when people are talking about something bad about their life, or they are giving out a lot of their time, a lot of their life to the community, or they are very, very jovial, right? Or if they're looking at, oh, what is my exam going to look like? Am I going to pass? Am I going to fail? We shouldn't see it as a bad thing necessarily. That may be their way of coping at that moment. That should be your takeaway here. Now, let's go ahead and talk about the unhealthy or maladaptive ego defense mechanisms. This we shouldn't do. If you see yourself in this, you need some support, not judgment. We're all going to see ourselves in this too, okay? What are the coping mechanisms? Denial, projection, displacement, rejection, regression, repression, reaction formation, rationalization, avoidance. These are the negative ego defense mechanisms. The ego defense mechanisms that are very negative that we got to stay away from if we really, really want to live long. Denial, projection, displacement, regression, repression, reaction formation, rationalization, avoidance. We need to find a way to stay away from this. So now let's go through each of them and let's see if we can see ourselves in this. If I see myself in this, I'll talk about it, okay? Now, what about denial? Refusing to accept reality or facts, insisting there is no problem with alcohol use, insisting that I'm not big, I'm still cute the way I look. Well, I may be cute the way I look, but I'm big, right? So that is the way it should be. You should acknowledge so you can find solution to it. Oh, I failed that test. Yes, you failed. You need to acknowledge it. Oh, I didn't fail. They cheated me. The teacher just disliked me. You are in denial. And I'm sorry, let's talk about death too. Oh, I know my grandma didn't die. I know she's alive. I know she'll be there in the morning when I go check her out. No, that is denial. So, you know what I'm saying? You don't want to acknowledge the situation or some kind of terminal diagnosis. You're just in denial. It's only going to weigh you down. That is not a good defense mechanism. Many of us do this. I know I didn't just fail that test. Oh, I know I didn't just drop out of anesthesia school. I know I didn't. Well, I didn't say that, but I'm just giving those examples. Now, what about projection? Attributing one's feelings of others, attributing one's feelings to others, accusing, for example, a partner of cheating due to own guilt. You are cheating on your spouse. I say, you cheat on me, you cheat on me. You are projecting. See what I mean now? Saying you are angry when they are angry at one. That's another example. Why are you always mad at me? But you are the one mad at me right now, though. I'm not mad at you. But they feel that way. And these are what I have not even talked about is what is conscious and what is unconscious. Hey, these are unconscious, as a matter of fact. Projection is very unconscious. They don't even know they're doing it. Okay? And I didn't link it to psychopathology here because I didn't want to drag it out. Okay? But they don't even know that they are doing that to you, to themselves, or to you, or to somebody around them. What about displacement? Redirecting emotions to safer target. yelling at a part. Now somebody, they just fired you on the job, or you were stressed on your job, you came and you start yelling at people, you are displacing it on them. Kicking object after being embarrassed in public. I remember when I was working at New York Presbyterian in New York City, this secretary would come. Nothing against secretary. If you're secretary and you're in the house, she would come and she would start kicking trash can and kicking early in the morning, 6:30. I'm like, what in the world, man? Like, she's just coming from her house. Whatever the case is, she's displacing it on, or whatever the case was, she would displace it on objects around her. And I'm like, what? And then regression, reverting to immature behaviors. This one is very interesting. Regression, repression, two different stuff. Regression, reverting to immature behaviors. Like when you cry too much for attention as an adult, and we cry as adults sometimes, but when you cry, say the word excessively. See what I mean? When you just come up with, I'm not just crying. When you punch walls, when you slam doors because you're not happy with something. Does it make sense? Those are regression. Those are like, think of that kind of a patient. If you're somebody doing that, or if you have a family member doing that kind of a thing, you want to tap back into their childhood. You're going to see, if you're a therapist, you can do psychodynamic therapy to actually see what their past was like. You will know there's some kind of pain there. They're just not regressing just to regress. Something happened. Now they have to kind of, so then now it's coming out. So I'm saying, like, I don't know how to really say it, but something happened as a kid. Now they are grown, but somehow they are locked into that past as a kid, right? So they don't know how to really structure themselves. They don't know how to coordinate themselves when they get angry. They will punch walls, they will throw things. Um, I don't know. I'm sure you've seen what I'm talking about too. It happens a lot in our society, or some people will just cry, 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 cry. We all cry, don't get me wrong. Now I'm saying excessively, okay? Now, what about repression? Unconscious blocking of painful feelings, forgetting a traumatic event, can't recall abuse from childhood, you are repressing it, which in a way, it may be good, but then if one small thing can also trigger it, so that makes it a negative ego defense mechanism. Now, what about reaction formation? Acting the opposite of true feelings, like being overly kind to somebody you really, really, really hate. Laughing too much when feeling insecure. So that's why they always say some people that laugh, 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 laugh. There's always something behind that laughter. We say excessively. So let's pay attention now, okay? So, because I don't want you to think, oh, I laugh a lot. Doesn't mean I have this, I have that. No, no, please don't be diagnosing yourself. There is always a spectrum of for anything. We have, let me say something at the end, we have something at the tail, or let's say we have white, we have black, and we're supposed to have the gray in between. The gray in between is supposed to be the norm. We shouldn't have too little, we shouldn't have too much of anything, just like with anything in life. So when we use the word excessively, we mean excessively. Okay, so with reaction formation, you don't feel like really laughing like that. Deep down, you're not laughing, it's fake, but you have to laugh. I mean, I don't know if anybody know what I'm talking about. Now, what about rationalization? Making excuses to actually justify harmful behavior. I yelled because I'm angry. I failed because it was unfair. I failed because the teacher hate me. And this is one thing I teach my kids. I'm like, teachers don't even know your name. You okay? Don't be assuming that teachers hate you. And there's nothing like that, in my opinion. They're too busy. And, especially now we have A, B, and C as an answer. So how can any teacher change your grade? So you didn't study, you didn't study. You need to acknowledge that to move on in life instead of rationalizing it. What about avoidance? Evading difficult what emotions or tasks, ignoring overdue bills, avoiding conflict by changing the subject. That is avoidance. Some people change subject also for some other reasons, like maybe their mind is all over the place, like mine sometimes. They're talking something else, their mind goes something else. That's different. This avoidance is so clear, as in, so why didn't you come to my event yesterday? Oh, so how was your basketball? How was your son's basketball? Like quick change, like totally off topic kind of a thing. Instead of addressing that particular one first and then keep it moving, just want to avoid that being questioned about what happened. Okay, so now we're now going to go ahead and quickly talk about um I didn't want to talk about this, but I think I need to as well. So those ego defense mechanisms are mental health based, right? So I'm going to just talk about a little bit of them. I'm going to just come on once. Let's talk about paranoid personality disorder. People that have paranoid personality disorder, they tend to project a lot. See, they project a lot. You remember what projection is? To take out that emotions, they take it out on somebody and it's not true, but that's what they are feeling. oh, you cheat, oh, you're lying on me, but they're the ones lying on you. Or you cheated on me, but they're the ones cheating on you. That's projection. Okay, now what about borderline personality? First, this one is interesting. The ego defense mechanism is splitting, projection, regression. You see why they are so complicated as people, as patients. And I'm sorry, no offense, maybe I shouldn't be saying that, I take that back, but they are kind of tough to handle as patients because splitting means, oh, that stuff is good, that stuff is bad. And sadly, when it comes to law courts and stuff, we believe them, right? Whatever they say is accepted, is believed. We listen to them, but they might have some personality disorder, right? They also project. They also have regression. That's a lot to combine in one personality. They say people as either all good or all bad. What about histrionic personality disorder? They use regression and they use a lot of denial. This childlike attention-seeking stuff may deny emotional depth or consequences. What about narcissistic personality disorder? They use projection, rationalization, and denial. This also makes them a little complicated. There's a lot of ego defense mechanism to have in one person, and they are all negative. Projection, rationalization, and denial, all negative, right? So they project their insecurity onto others, they deny fault, they rationalize what? Entitlement. What about antisocial PD? They rationalize and they also use denial. They justify harmful actions, they deny guilt or empathy. What about people with depression? That is also nice to talk about because a lot of depression is common, anxiety is common. People with depression, to be exact, MDD, because we have types of depression, right? We have MDD, which is major depressive disorder. We have disruptive mood dysregulation disorder. We have which one? We have dysthymia, right? And then we also have PMS, which is premenstrual dysphoric disorder, the one that women go through 7 days before their period. Those are the four main types of depression, right? So what do they really use? The specific type of depression that we're talking about here is MDD. What do they use as ego defense mechanism? They use introjection, regression, repression. So these are all negative ego defense mechanism as well. They will turn anger inward, which is introjection, and they may regress or repress emotional trauma. Both are not good. Now, what about anxiety disorder? Specifically like GAD or panic, they will use avoidance, of course. They want to walk away or run away from something that make them feel anxious. I think that should be common. That's common, right? You want to repress it. You want to displace the situation. So whatever it is, they want to this is all negative too. So they want to push anxious what thoughts away. They may display stress onto safer targets, right? Now we have conversion disorder. These are not common disorders. I will not talk about that. Schizophrenia, maybe I can talk about that. They use denial, they use projection. They may deny illness or attribute hallucinations to external sources because they don't want to believe that they are hearing what they are hearing. I think anybody will use that defense mechanism, right? If I'm hearing things, no, I don't think I am. I don't think I'm saying that. You want to just kind of find a way to cover it up. People with substance use disorder, I think, is what we're talking about. They use denial, rationalization, and projection. I don't have a problem. And it is true, guys. Test it out. If you know someone that uses substance, ask them, do you drink? They just finished 10 bottles of liquor, whatever it is called. And they will tell you no, flat out no. You can smell it and you can see it dripping from their mouth, from their nose, from their ears, and they will say no. They're not lying. What they know to use is denial. That is a defense mechanism in them. So you don't count on them to tell you yes before you get them help. You go ahead and get them help that they need, regardless of whether they deny it or not, because they will always deny it. Now, what about dependent personality disorder, regression, idealization? PTSDs, they will repress, they will isolate, right? And they also dissociate. Now, dissociation also comes with different types of, amnesias. So we don't want to go there yet, right now. Then, but we also have phobias, right? Displacement is what we use as phobias. The fear of specific objects, right? Situation, places, and they have deeper fear of flying, fear of losing control. Some people really wouldn't ride a car, guys. Some people wouldn't fly. Fly, I even get it. But if you cannot get into a car from point A to point E, I don't know what to, that's tough. That's a tough place to be. All right. So that is it for ego defense mechanism. I really wanted to hit on that. I hope I was able to break that down to, to a biteable size. And what I'm going to quickly, I have applications here to kind of go through. I don't want to go into academics. I rather us go into talk. Let's talk, let's converse. I'm going to leave the rest. So that kind of ends my presentation today. But which one do you see yourself in here? Is it the healthy or is it the good ego defense mechanism or the bad one? If you have too much of these bad ego defense mechanisms, you need to start working through that. You need to start finding your way to get back to the positive ego defense mechanism. Do we have any questions at this time? Thank you for listening.
Thank you so much. Wow.
Thank you.
Wow.
Appreciate you. Excellent.
You have a question? Do you have a question?
Dr. Asadu, you have a question?
Yeah, no, you explained it excellently.
Thank you so much.
Totally appreciate it.
Thank you.
Thank you.
So if you have any questions, you can raise your hand or put it in the chat box. My voice is not allowing me.
That's understandable.
I found myself in one.
You
That
do?
was when I got into counseling. I think it was repression. Just forgetting anything that happened. Thank God counseling works. It's in a good place. All of these things are important to know. But like Dr. Elisha said, recognizing that you have something is important so it can be addressed. There's solution to every single one of them. And I'll venture to say that the solution starts from counseling. I'm surprised there are no questions yet.
Or thoughts or comments?
Yes, thoughts, comments. This was deep.
I have a comment, please.
Yes,
I'm
please.
sorry. I'm Tinu Akinshola.
Oh, yes.
Thank you.
I still have your award. It's waiting.
Oh my gosh. It is well. Thank you so much, Dr. Kehinde Elisha.
Yes,
You did a wonderful one. I
Thank
know I joined late, but the little I met, it's like until when you will say, oh, don't get ahead of yourself, don't diagnose yourself. So I'm kind of like seeing myself in everything you are saying, you know. So but then you say, no, wait for it. So it's like a note of caution. But before Dr. O said anything, I started thinking, I think I have all these things that she's talking about. But I know that, of course, there is bound to be some traits of all this in us, but the excess is the word that you really want us to pay attention to. And that's what really took me aback. But thank you so much. I want to say that, just as Dr. O said, but for me, I think when you recognize it is the first step in you being well. So counseling is just like you take yourself to the person, you know, but the first step is to stop denying, you know, because for me, I can put myself in 1, 2, or 3 things because in the last 3 years, I've had so much mixed emotions, you know, with the burial, with the grieving part, and then come birthdays, then come somebody's wedding, that, you know. So, but still not trying to dwell in the dark path, but I still think about it. So, but thank you for putting it in context for us.
You're welcome.
We do have a question in the chat from Pastor Paul. His question is, where does psychosomatic I guess, occur, or in what situations would they happen?
Okay, psychosomatic. Okay, so first of all, psychosomatic would fall under somatization disorder. So I would say, because it's a broad concept, can you be more specific on the type of psychosomatic?
Pastor Paul, can you shed more light on that? Your question was just straight to the point.
Because it is not actually a DSM-5-TR diagnosis. We have somatization disorder as part of my DSM-5-TR. DSM-5-TR is pretty much the Diagnostic and Statistical Manual of Mental Health Disorder, 5th edition.
Okay.
However, when you're talking about psychosomatic now, you're trying to refer to the connection between the mind, which is the psyche, and the body, which is the soma. But then we have different types of somatization disorder, but that will be more academic. That and they have different kind of triggers and stuff. So which part are you really talking about?
No, I believe, you just address it generally, and that's exactly what I was looking for.
Oh, okay, that's what you're looking for. So I addressed it already?
Yes, thank you.
Okay. So if that is kind of what you're looking for, then if it's a general part and not really somatization disorder, because somatization disorder, that's why we have the factitious disorder and all that, illness, anxiety disorders, but it looks like you're not focusing on the psyche. Now, when we're talking about the mind and the body, then somatic itself, when you think about neuro, okay, we have the CNS and the PNS, okay, and then the peripheral nervous system, that is kind of where the somatic system falls under. And people just have bodily
Okay.
even in the DSM-5-TR, the somatization disorder is about people having bodily symptoms. Illness, anxiety disorder falls underneath it. Factitious disorder falls underneath it. Malingering falls underneath it. So that's why I'm saying specifically which one. But since it's general, I can imagine you're talking about the one with the bodily symptoms. Like people just feel like they have peptic ulcer disease, irritable bowel syndrome. Usually, when people are under constant stress, that is what leads to peptic ulcer disease, right? When people have IBS, they often have flares during some kind of stressful situation. Those are we all fall under psychosomatic. But again, let's recognize it is now under the DSM-5-TR category though. And then tension type headaches is also technically psychosomatic. Hypertension can be psychosomatic induced based on you having financial stress, you're worried about this and that. When people have asthma and they have an exacerbation, it is due to psychosomatic. They are triggers. Something triggered it, right? And then psoriasis, even skin rash, those are also psychosomatic. That's why I said specifically which one. So I'm glad I was able to address your question. Thank you.
Appreciate it. Thank you.
Thank you.
Thank you for answering that question. We have Dr. Gunle's hands raised. She have a question.
Yes, please.
A question and a comment. Hello,
Sure.
Dr. Elisha. How are you?
Good, how are you?
I'm fine, thank you. So, I rarely allow myself to get depressed, but when I do get stressed, one of the first things I turn to is comedy. I just turn on the TV, look for a comedy channel, sit there and just laugh my ass off all night. The other, you were just talking about psychosomatic. I'm one of the people, one of those who experienced that. And that was one of the reasons that I actually retired early, because I was noticing that the state of education was just getting me stressed. And I was beginning to yell at my students. I was getting irritable bowel syndrome. I already had peptic ulcer from my early college days, and it was getting worse. So that was when I started getting all these physical symptoms. That was when I knew that I needed to pivot and just leave. But I'm also one of those people that takes to heart the Buddhist teaching of non-attachment. There's nothing that I can't let go of when it stresses me out. Would you consider that a positive or negative coping mechanism?
So if you will so now, first of all, thank you so much for sharing your story, by the way. The ability to let go of something as well, and it's not affecting your other life already is positive, period. So I definitely would consider that positive. Now, the initial piece that you stated about, things were getting to you a lot. So you must have not been, and then you will start yelling at people. Now that would be negative. But then you were able to find that you're able to catch yourself in time to pull back. So you pulled back and you didn't go down that path, and it didn't yield a negative results, and you didn't develop some psychopathology from that. So you still did well turning around. Listen, let me tell you the truth. A lot of this ego defense mechanism, it kind of manifests in all of us. Now, the chronicity of it is what makes it a problem. The ability to adjust and turn back is good. For example, when somebody fail an exam, they go down, they're depressed for a couple of days. That is only human. Some people are on a job, they don't like it and they're depressed. That is only human. But how long were they depressed for? If you don't like that job, or if you fail that test and you go down, how long were you down for? Now, that is what would define a problem. It is not a problem if you're able to pull yourself right back. It doesn't make sense now, and you rose above it. So whatever the ego defense mechanism that was negative that you used, and you were able to let go and you didn't hold on to it, you still did well. So overall, I think you did well based on the story that you narrated. Thank you so much for that question.
Thank you. So I have another question. Good Jay says, thank you for the beautiful presentation. Besides AI and other stressors, when one thinks about the political violence happening around us, what emotions tend to rise up most, and how do those feelings shape day-to-day life for the common people/person?
That is a brilliant question. Thank you so much for asking that. And before I'm going to answer that, but before I answer that, I want to quickly give everybody, because I feel like we're going to have more questions if I attach the definitions. So I'm going to go ahead and give a summarized definition. So to those of us that are just coming in, we just finished discussing positive and negative ego defense mechanisms. So now if you're not familiar with this concept, I'm freely sharing all of these concepts. Please go ahead and take it and hold on to it. Now, please, it's in the chat right now. Pull it up and download it and review it and personally just process it as we're going through this, either now or after the whole event. Now, going back to your question, it's actually sick and sad to see what's going on in the society, the gun violence, you know what I'm saying? And the worst thing is that how things are being shared in milliseconds, as in public assassination, for example. May his soul rest in perfect peace. And can you imagine somebody seeing that? Like there's something it does to the brain. That's traumatic, period. Whether you're a kid or an adult. Just seeing that with circulator, as long as you have that human flesh and you are human, even if you're evil, okay, it will replay in your brain that, oh my gosh, this can be me. What if I go to Walmart and there was there was a gunshot sometime in Walmart. I don't know which state it was. Who doesn't shop in Walmart? There was a gunshot somewhere in Harris Theater. Who doesn't shop in Harris Theater? There are gunshots in schools. Who doesn't go to school? There are gunshots everywhere. So you're like, that could have been me, or in the mall too. So how do we cope? Okay. We're going to still have to find a way to adopt some coping mechanism in the middle of all this. Otherwise, you're going to freeze. If you freeze, you won't be able to achieve anything. Does it make sense? So what do we do then? When it comes to coping mechanism, how do we do it? So first of all, you will go through grief, period. Okay. But don't let it bother you so much that if you're grieving for more than 2 weeks, for example, it's going to turn to major depressive disorder, for example. So we can't allow things to last that long. It is that serious. And that is why it's so sad that something happened on Monday. By Friday, people are back to their normal life. As sad as that look, as tough as that look, it is necessary though to move forward in life. Does it make sense? It is just a natural way of life. You got to move on. If you don't have that ability, that is where help will come in. And when you talk about how do I cope? So a lot of the coping mechanisms that you can use, you can still dump that negative things, trying to say, oh no, I can't believe that happened. Or, trying to suppress it, or say, you know what? maybe it happened because of this or because of that. You're trying to rationalize things. Instead of doing all that, you can go ahead and sublimate. How can you sublimate? Take onto social media and start being an advocate. Those are positive things you can do. And start preaching something good and start, people are talking about it, find a way to turn those words around. I tend to use that a lot these days. No matter how terrible a situation looks, I'm going to look for a way to dilute it. But you have to do that strategically too, because the person that is going through that thing, they tend to like feel really hurt or offended when you try to switch stories around. That, you know what? Let's look at it this way. But so you have to be careful using sublimation. So that is one way you can cope. We can use humor. Humor is a positive ego defense mechanism, but we cannot use it, period. You know, that is not funny at this time. We cannot be using that. Somebody died, that's somebody's family. But you can also be altruistic. So you want to give part of yourself to somebody else. Even if it is writing a letter, you know, to somebody around you that is also grieving. If you're able to, that will also make you feel better. Or people that are volunteering, or if you have any connection with the social media, or even going online and posting and expressing your condolence or something, just giving that piece of yourself in some way, and slowly you're going to find yourself disconnect from it. And that's only one case, okay? But I'm saying, how many people do you want to reach with all the gun violence? But mentally, how do you switch your own brain to keep functioning? It's going to be your focus. I'm sorry for saying that if it's too selfish, but I'm saying too, though, you don't want to get down into that hole, because we have two main mood states. Our mood can either be up or it can be down. If our mood is up there and it stays glued up there for too long, we can only do two things. We can talk that patient down to come down to the normal state of mood, or we can use medication to bring them down. If your mood gets down to the bottom of the pit, which is depression, we can either use meds to pull you back to the euthymic state, which is the midline, or we have to psychotherapeutically through counseling pull you back to that state. So bottom line, we don't want anybody to be off of that midline. And sometimes we do get off of it. If we do, we shouldn't get off of it for too long. So situations that like gun violence and stuff like that will get us off track, but we must find a way to bounce back. And that coping mechanism also must be positive. Whatever positive one that you can adopt it. Thank you so much.
Thank you for that. We have Mommy Tower's hand raised. Mommy Tower, do you want to unmute yourself?
Hello, everyone. How you doing, everybody? Thank you, Dr. Elisha. I'm sorry if I messed up your name. I have like two questions here. The first one that Dr. O said, repression, that if it's happening to you, then you need to go counseling. Is it possible to have it and just manage it yourself? Because I'm talking of like 25 years ago. I had it, and what I did was like everything that comes, I repressed it to move on. This one comes, I have so many negative things that happen at that time, so many, and I just keep on repressing them, and I was just doing anything I want. And finally, it left. But I'm sure I had it for more than 1 to 2 years. And can I do that instead of, because I never went to any counseling? And the people from where I come from, Nigeria, how many people really go to counseling and things do happen to them?
All right, thank you. You made two good
number one. So
okay.
I'll deal with that first.
Okay. So you made two good points now that I want to quickly address. The first one that I want to jump on is Dr. Ho is right. Counseling is also therapy, psychotherapy. We call it talk therapy. Talk therapy is a treatment also. We use words to heal people. Now, the second one I want to quickly address right now is the fact that Nigerians, they don't do therapy and they're fine. Listen, mental health, we call it what? An invisible disorder. Many people are sick, just like it is in America too, not just Africa. People are sick and they have a lot of, they have mental illness from the past traumas and situations, but they still wear normal human clothing. Does it make sense? So the fact that they look okay does not make them okay. Does that make sense? The fact that they look okay does not make them look okay. So now if you feel like it is less on you, let me tell you what's likely going to happen. A lot of people with depression, actually, they go through traumatic experiences like PTSD. Let me tell you with PTA, what happened to PTSD patients. They end up coming back to re-experience that event. Whenever they get exposed to it, they will end up re-experiencing it. So it is not gone. I pray that yours is gone. But I'm talking now based on psychology. I'm not being spiritual here. According to DSM-5-TR, it is not gone. It's still there, tucked in. That when we have or see or even smell the situation that surrounds that situation, it comes back. Okay, so it is not really gone, but maybe spiritually, if you find it gone, then I totally respect your point. But help is still important if it is a big deal, and it's because you wouldn't know that it has affected you a lot. It might have affected your relationships. Where's the worst part? It affects relationships that we don't even realize it. And because it's many of the things are so unconscious to you, the people around you are the ones feeling it. Let me tell you what I tell people. I tell people, if you have kids, even if they're not your kids, if
That
you
is
live,
true.
is that a problem? Am I correct?
I said that is true. My kids too.
They
So
are the ones that will suffer, unfortunately. And that is, so you are going to be thinking you're fine because it's unconscious, but people around you, they are feeling it so badly. And that's why people around you that live inside of you, it has to be an intimate partner, intimate family member. They are the ones that will tell you, not co-workers, you're going to be the best person on the job, as a matter of fact. And I'm not saying you are a bad person, but I'm saying it is the people that are intimate that really know you, period. As in people that live in your house. You will now totally honestly ask them, what do I do that bother you so much? What am I doing that you want me to fix? I would ask my 11-year-old that. I would ask them when they were 8 years old too. I'd be like, okay, what do you think mommy do that you don't like? By the time they point it out, I pull up my ego defense mechanism. And then my kids would tell me sometimes to be like, you always, African women, we kind of yell a lot, to be honest. They'd be like, you're shouting, you're shouting, you're shouting. When people are saying you're shouting, maybe you shout. Maybe you need to like tone it down. You know what I mean? Or when I talk, you don't let me finish. Maybe you need to watch that. My kids will tell me that. And I know I do cut people, but it's not deliberate. But I quickly pull myself back because my brain is always like forward working, and it's annoying, right? So those are the ways to kind of get to know ourselves and to tone things down that affect people around us. So when the big thing is that it's a plus that you recognize the defense that you use and you know it's negative. The way forward here is start interviewing the people around you. Say, I will not take it personally. Tell me the truth. What do you honestly feel about me? What do I do that hurt you the most? And then you're going to put it all together. And then you're going to come to find out, okay, so this is what I do. Not just to them. This is what I do. This is what I do. But like, okay, so this is kind of my behavior. So it's kind of like the way I act. So this is affecting them. So I need to find a way to adjust it. And you cannot do it yourself for the most part. You need therapy for the most part. If you feel like you don't need therapy, then you have to just make that conscious effort it's going to be conscious effort. It's going to be tough to do alone. And have to constantly remind yourself or even assign that person that is intimate to you to remind you when you do such again. And then slowly you're going to start seeing improvement. Thank you.
Okay, the second part of my question, that one, I don't even know where to place myself. When something that is very bad happens to me, I don't do it as often as I used to. I will just go out and do a spending spree. I will just go and spend on myself a lot of money. What is that called?
Okay, I'm not going to diagnose here because I will need a lot to walk through that. However,
I was tempted.
Yes, I don't want to say, I don't want to say, I know what you're thinking. You want to say the word be, right? Okay. So we don't want to do that. We don't want to do it because there's a lot to walk through. And some people will show up out of being so stressed. But then, there are some other, pathologies that also present that way. However, we will need to go through some kind of scale to put you on a scale before nailing that, before calling that what it is. But we can't say what it is until I get collateral, a lot more information. Does it make sense? Is it just spending spree? Do you sleep well at night? Do you find yourself staying up for 3 days and not sleeping and still not tired? Do you find yourself being talkative at times? Do you feel the sense of importance sometimes? And the spending spree, is it attached to some situation for that moment? And do you catch yourself and stop? Now, if it is not that, if all that is no and you're not, and that's not you, and then the next question I want to ask is probably, okay, what does it feel like when it comes to, you know, do you hoard stuff? Do you like to keep, I'm just buy and just keep? Does it help your anxiety? Does it help you feel like you have enough? And then you are calm that way. See? So that one single sentence can mean so many things. I came up with 4 differentials in my head already, but I can't throw any of the diagnosis out because I don't have the scale to make that conclusion. But definitely that's worth working out. Thank you.
Thank you very much. I appreciate that. Dr. O, you want to talk? You will talk later.
Dr. O, you have a comment to make?
I do have another question in the chat. This is from Dr. Ellen Oshonowo, and a question is how does culture influence the way somatic I'll go again. How does culture influence the way somatic symptoms are expressed or reported?
Oh, how does culture influence how somatic symptoms? So culture has a lot of influence on it, as a matter of fact, because naturally, some people just feel that way in some culture. Anxiety is big in our Indian culture, for example, and they term it to be, so it's going to vary. Culture has a lot of impact on, in fact, in mental health in general, culture have a lot of impact on it. Some things that we call pathology is just a norm in some culture, just an expectation in some culture. But what will not be normal in any and every culture is when we call it somatic symptom, but then we are really seeing the symptom. Somebody have peptic ulcer, somebody have ulcer, and they are really bleeding physically. We need to deal with that as it is. Then we will not really call that culture anymore. But culture do present some symptoms that are actually linked directly to culture. I hope that really answered your question. So culture has a big part to play, but not everything is culture too. We need to look beyond culture in so many situations when it comes to somatization disorders.
Awesome, thank you. Mommy Tara, you have your hand raised again. Do you have another question?
No, please.
Okay.
Do you feel like I answered your question?
Yes, you did. Thank you.
Thank you.
I have another comment here from Good J. Mr. Good J. I'm not sure if that's a man or woman, but they said big thanks so very much for the answer. The real question is how much of what we hear is the truth and how much is cherry picking. We all need to pause and focus on becoming part of the solution, even if that doesn't always come from elected officials. Staying balanced and keeping the midline, as you mentioned, is such a valuable tool. Thanks again.
You're welcome.
And we have a couple of thank you messages in the chat. They're giving you some kudos here. Excellent and very informative. Thank you so much, Dr. Elisha. This is from Dr. Ethel. Miss Stella Ejeku. Sorry if I butchered your name. I'm so sorry. She said beautiful presentation. Miss Adiola Ate Koja said excellent presentation. So, and then Dr. Lola Aderonke said totally awesome. I give you a clapping hand emoji.
Thank you.
Yes. So thank you so much. Do we have any other questions, guys? All good.
It's Rosemary. Rosemary raised her hand.
An observation.
Yes, good evening. Good evening, everyone. Dr. Elisha, thank you very much for great presentation. You know, I get very, very worried about the stigma for mental health because we live in this life and we all go through traumas all the time. In our culture, you know, in Africa, people lose loved ones and they think that they can just move on like that. They haven't even grieved that person. And they don't even understand how that's not taking time to grieve their beloved one, how it's going to show up in different areas in their lives. Just like you were talking to the lady, you said, you know that you have worked on your issues, you know, through prayers and everything. But guess what? The people around you are feeling it. When we don't take care of our own issues as parents, we pass it on to our children, unknowingly onto us. Okay? So you fear what you don't face, and what you don't face indirectly controls you.
Correct.
So, yes. So, it's a lot that is happening, because I once had a client, a couple, and they came into my office, and the wife is like, "No, I don't want this man anymore." She was just like, she's out of this relationship. Then I told the guy, I said, "You know what?" I asked, I said, "Do you want to stay in this relationship?" The guy said, "You know what? I love my wife. I want to stay in this relationship." And the wife was like, "No, I'm tired of it. I don't want it anymore." So I said, "Well, okay, you can leave." She left. I told the guy, I said, "You know what? Are you ready to work with me? I am going to work with you." I said, "I will work with you to the point whereby your wife is going to end up begging you." He was like, "No, you don't understand. This woman is already." I said, "Don't worry about it." So I started working with the guy. During my counseling that guy, I found out that this guy lost his mother 15 years ago, and he never grieved the mother. So I gave him the opportunity to really ask him about his mother. And what happened? This guy wept for more than 2 hours in my office. If you lose a loved one and you don't take care of that, you don't take care of your mental well-being at that particular time, you can lose yourself. You can lose your identity. You will lose who you are. Low self-esteem will come in. A whole lot of things will be happening to you. So this guy lost himself in that process, and he actually started seeing his wife as his mother. The pressure was so much on his wife. She couldn't carry it. You can't even blame her. So by the time I started working with him, and this guy, by the time I was done with him, this guy had so much confidence. He was, he got promoted at his job, started dressing well, started, being himself. He found himself again. Let me say that. And guess what? 3 months later, the wife called me. "Oh, ma." I said, "What is it?" He said, "I want to report my husband to you. I think he's seen somebody else." No, he's not seen anybody else. He just got, to find himself. So I had to call him. I called him. I warned him. I said, "Look, get back to yourself again. Do the right thing by your wife." And then she called me. She said, "Can I come for counsel?" I said, "Sure." She came in. So they are doing very well today.
Wow.
Yes.
That is remarkable.
True
See how
story.
much. So you're a therapist, I must say, right?
Yeah. Yeah.
Wow.
I'm faith-based, yes.
That's my therapist.
You shouldn't be leaking it.
I want to lick it. I want to lick it.
She's my therapist too. You're my therapist too. So what I'm trying to say is
that is true.
It's so important for us to find the root cause of issues. I don't treat symptoms. You can come to my office and tell me, "Oh, I have this, I have that." Okay, that's fine. But let us see what is going. Let me help you to connect you with God first of all, and then connect you with yourself. And then you can be able to reach others. Because the Bible says, the first commandment in the Bible says, "Love the Lord with all your heart, with all your mind, with all your strength, with all your being, with every fiber and every ounce of blood in the body." And then the second is like unto the first. "Love thy neighbor as thyself," which means you have to love yourself. What is love? People just think that love is just... No, love is patient. Love suffereth long and is kind and is patient. It doesn't seek its own. It's not easily angered. It's not really provoked. It seeketh not, it believes all things. It hopes all things. It endureth all things. Love never fails. When you can be rooted and grounded in love so that you can be able to comprehend with all sense and be able to understand the other person, because the hardest person for you to understand in this life is yourself.
Preach it. That's what I'm talking about.
Once you are able to understand yourself, everything else becomes easy.
That's right.
Yes. So if you don't know who you are, and then you get married to somebody that doesn't know who they are, guess what?
That's right.
There's going to be confusion in that home.
Fire for fire, yeah.
Okay, so the children are confused. They don't even know what is going on. The children are like, "Why are my parents married?" They're crazy. Okay,
right.
These kids believe that the parents have a bipolar. And for crying out, say, please let us work with our young ones to find out who they are so that they can make better choices of of their spouse.
Absolutely.
If not, these things will continue for the rest of their lives.
That's
Okay.
right.
And then once you're married, you see that you're having issues in your marriage, please get help. Get help. Get help. Know who, find out what's going on. And then the marriage doesn't have no problem. It's the people in the marriage that has issues.
Correct.
Okay. So when I have marriage couple in my office, I bring them in for the first time, then I separate them. I work on this person, I work on the other person. By the time they come back together in my office, they met in each other's arms. They just love each other because I would teach, because I already taught them how to love themselves. They're free. Thank you. Sorry if I
Wow,
go.
thank you so much. No, thanks. This is a good point.
Thank you.
Thank you so much. Maybe you can drop your information in the
Good
chats
job.
too, just for many to connect. Thank you so much for that comment.
My pleasure. Thank you, ma'am.
Thank you. Dr. Guled, would you still like to make a comment? Because you had your hand raised.
Yeah, I just wanted to make a comment about AI, that I probably was one of the first victims of AI.
Oh, sorry to hear
AI
that.
didn't take my job. I just let it go because students were using AI to turn in assignment, and when I give them tests or essays to write, I teach mathematics, and I taught mathematics, and I taught college students who want to be teachers how to teach mathematics and science, STEM generally. And I'll give them assignments. Their writing, some of them, their writing is so horrible if it's in class assignment. And then when I give them homework, they come back with this essay that you just know is AI. And when we were in school, the way teachers know that you don't know what you're doing in mathematics is they'll say, show your work, right? Well, now AI shows them the work. They will just download everything step by step. And then you give them the simplest assignment in class and they bum it. That got me stressed. And the administration, they're always blaming the teachers. It's the teacher, it's the teacher. And it's not that the student won't go home and study. No, it's always the teacher. So AI did that to me. AI made it easy to cheat. So I had enough.
So how did you cope? So you did walk away?
Oh, I walked away. Yeah. Non-attachment. Yeah.
Wow. Okay. So the defense that you kind of use there is more of timeout, suppression.
Yeah. Okay.
Escape, you did denial, repression, rationalization, the reason to leave. Then you avoided the problem too. So you use so many defense mechanisms. So you don't think you'll be going back to teaching again, right?
Never.
Really, because of AI for real?
Well, because of, like, I went into the profession to teach, not to be a babysitter, not to be grading AI papers. AI is not my student. They are my student. If I can't have the whole student, then it's not for me anymore.
But you love to teach.
I do love to teach, and I still kind of teach, unofficially, but as a career, no, it became too stressful for me.
So can I give you a solution to a problem that we can't really hand? AI is not living anytime soon.
I know.
So if you love to teach, you don't want to deny your own passion. Does it make sense? And you can also change people's lives through teaching, but there is a way around your issue right now. You can even be the one to make that situation possible. I don't know how many students you teach, but why don't you? I know you can't provide solution to everything, but may I suggest not going back to your work, but if you have to get another teaching job, expect this to happen too. And even without AI, students were teaching before anyway. In that case, why don't you come up with oral tests to let them exit that course? And does it make sense? And introducing something like new to the school about, okay, let's overcome AI by not doing multiple choice. Let them write out like we used to do in Africa. We need to just go back to those old ways. And when they are writing out, they are not doing thing out. Unless it's online, it can be online. It's gonna be supervised. Like it's gonna be tighter security. That is not a multiple choice. Providing that solution may help, but if you feel like, you know what, I'm stressed out, if it's stressing you that much, you know yourself too that you feel like you miss your job though, right? That alone right there is stress for you if you don't, I think. You know,
I really don't
You really don't miss your job? It stressed you that bad?
I am multifaceted, Dr. Elisha.
So
I was doing something before I went into teaching, and I went back to what I was doing.
So you went back. So you had a good alternative. Okay.
She's the one who makes the Obalende suya that I was showing off on Medic Mondays that I order.
That's amazing.
She sends it to you fresh. She makes natural skin products.
I need that.
Skin issues. And that's what she does now. She's a professor and she's retired. Also, she's a vet. So thank you for your services.
So if you're retired, then that changes the story then that's retirement. Yeah. But if we're going to go back to that teaching, the AI is here to stay, unfortunately. So we all can't run from it. But thank you.
I'll leave that to the young teachers.
What you do now.
I leave that to the young teachers. I'm done with that life.
So yeah, I'm glad that it's gonna take energy now to get students to focus. It's gonna take a lot of energy.
Oh my God.
Many are using AI to write. Many are using AI to breathe. It is insane.
Yeah.
So I just really respect your decision, ma'am, and congrats on retiring.
Thank you. Thank you.
Yeah, we are still new teachers. I'm all in.
You do a good job.
Oh, thank you so much. I try.
Thank you.
Awesome. Thank you, guys. We can have a couple more thank you messages in the chat and also presentation in the chat as well. Do we have any other questions? Any other person feels like sharing? We don't judge here. And Dr. Kehinde Elisha also added in some PDFs for anyone that joined the call late, so you can download them. And if you have any questions, you can always reach out to us. Awesome. Mommy, do you want to take over? Do you have any parting words for us, Dr. Kehinde Elisha?
Yeah, so what I just want to say is that, whatever ego defense mechanism that you just, first of all, be mindful that stress, we're always going to have some kind of stress in life. It is almost inevitable. As long as you are human and you have that human flesh, it's going to be there. So the question now boils down to, how do you cope? Are you using the negative mechanisms or the positive ones? If you find yourself in the negative side, seek the necessary help. If you find yourself in the positive side, go ahead and keep that and maintain it. If you think you're kind of partially okay being on the positive side, negative side, just don't think about you alone. Think about the people around you too. And thank you all so much for being here tonight. I hope you took away one or two things.
Thank you.
Thank you so much.
You're welcome.
And I want to thank my daughter for really hosting this tonight. Thank you for bailing me out. Till we see next week.
Hey, what happened to your voice now?
And on behalf of everyone, we say congratulations, Commissioner Dr. O.
Yes.
For the well-deserving award. May the Lord continue to guide your steps.
Amen.
Bless your work.
Amen.
Abundantly, and open even greater doors of opportunities.
Amen.
And influence for you.
Amen.
Your achievement inspire many, as it's already doing.
Amen.
God's favor and wisdom be upon you always. Pray for strength, that you are recovering, and your recovering is quicker and sooner. Glorify God's name. We say,
Amen. Congratulations, Dad.
Congratulations. God bless
Awesome, madam. Blessings.
God bless you.
Dr. Kule's kebab la ma fi well.
It's great, man.
Thank you.
Yeah,
We love and appreciate you, man.
Congratulations, Dr. O. Congratulations.
Thank you, ma.
Congrats. We shall say, Barbie, then pleasure to see you. I'll see you, Dr. O.
Congratulations.
Dr. O, congratulations.
Congrats.
When your voice was cracking yesterday, I suspected this would happen.
You knew. Yes.
Thank you. God bless
God
you.
bless you, Dr.
God
Elijah.
bless you, my
God bless you,
lady.
Dr.
Good night,
O.
everyone.
Thank you.
Dr. Fawale,
Good night.
go
God
ahead.
bless you.
Dr. Fawale.
Okay.
Dr. Fawale.
Yes.
Ambassador cannot crack. Oh.
Hello.
Okay.
Ambassador cannot crack.
No.
Must not crack. Oh.
Congratulations